Well, welcome back to Head On here on Shaw TV, continuing our discussion with Philippe Lucas, Vice President of Tilray, as we learn more about a commercial-sized medicinal marijuana operation about to set up shop in the Duke Point Strip here just south of Nanaimo. We'll also hear from Sasha Angus of the Nanaimo Economic Development Corporation to learn a little bit more of the economic impact. That's coming up in our next segment. Duke Point, Philippe, explain for our viewers the full inner workings. So what's going to be happening inside that big facility?
Well, we're doing nothing less in Duke Point than building one of the most cutting-edge medical cannabis production facilities in the world. We've got a $3.5 million building. It's 33,000 square feet. We're putting over $10 million worth of equipment and investment into that building. Ultimately, we're going to have over 50,000 square feet of production space, as well as a high-tech lab so that we can do plant research, clinical research, as well as social research on the potential harms and benefits of cannabis, and a lot of taxonomic research and genetic research on the cannabis plant itself. We're really excited about it all.
So this is so much more than just distributing medicinal marijuana to patients across Canada. You're actually at the same time doing research about the effects, positive and negative, of marijuana. Is that part of the whole business plan here? This is a research lab slash?
It is. You know, in the last segment we talked about the fact that prohibition had really gotten in the way of and stymied cannabis research. So a lot of the base research on cannabis still has yet to be done. That's a shame, but it's also an opportunity for those of us who are interested to learn more about this amazing therapeutic plant and the way that it helps others. And so we have a very active research agenda. I'm a PhD researcher right now with the Center for Addictions Research based out of the University of Victoria, and my particular area of study is looking at medical cannabis patients' patterns of use with a focus on cannabis substitution effect, which is the way that patients use cannabis instead of using pharmaceuticals, alcohol, and also illicit substances. So instead of looking at cannabis as a gateway drug, as has long been the kind of propaganda that's been around, I study the way that cannabis can be, for some people, an exit drug to problematic substance use and addiction.
Interesting. So explain how many patients will be through this operation at Duke Point. Has that been identified yet?
Well, we'd like to start out serving about 2,000 patients, and we hope that by the end of the year we'll be serving about 4,000 patients. The facility is going great. It's, as I mentioned, a super high-tech facility. We're going to have ultimately approximately 30,000 cannabis plants there, and we're really ready to meet whatever patient need comes down the road for us. So we're really looking forward to it. We've been getting calls all week from patients all across the nation, from the Maritimes, Ontario, etc., who are interested in Tilray and interested in finding out more about our cannabis products and our services.
I could imagine it must be a bit of a scramble with the old system moving out with these residential medicinal grow operations. Now it's to a commercial base. People are kind of trying to connect the dots. These folks trying to find their way to get their medicinal marijuana. Are you seeing that right now?
I think you're right. I think that there is some confusion out there. Some patients aren't sure exactly what the next steps are, but that's why we're here. And if anyone is interested in finding out more about the new medical marijuana program or about Tilray, they can go on site at our website at www.tilray.ca or give us a call at the Duke Point facility, and we'd be more than happy to answer any of the questions they might have and to help them however we can.
So the staff components, I understand in the range of 40 to 60, and you mentioned to me about before we started taping here, possibly more workers all working throughout this this outfit. Just explain the different roles that will be filled here.
Well, it was pretty amazing. We did a job fair a couple of weeks ago, and we were looking to hire 40 to 60 folks, and we had over 400 resumes submitted. We did interviews with 250 people. Since we started our kind of hiring process and the word got out we were hiring, we've received now over 1,000 resumes. There's an incredible amount of excitement, I think, in Nanaimo and all of Vancouver Island about the opportunity to work within this new legal biotech industry. And, you know, Tilray's goal is nothing less than producing an exceptional source of cannabis and providing the most patient-centered services in Canada. And so I think that both those propositions really excite people who want to get involved in this nascent cannabis industry.
Can you explain a little bit more about the footprint? You mentioned about 50,000 square feet for the cultivation area. There's the research component as well. What else is all made up in this facility?
Well, we've got a couple of thousand square feet of office space as well. As you can imagine, we've got significant security parameters in place as well, 24-hour security. We've found it very interesting that neighbors have commented when asked about how they feel about a medical marijuana facility moving in, that overwhelmingly it's not only been supportive, but they've been saying that they feel it's going to make the Duke Point area a lot safer because we do bring 24-hour security, on-site security with us. So they feel that it's going to actually make the neighborhood a lot safer, and I couldn't agree more.
And in terms of renovating, it's an old warehouse, I understand, and you guys have injected quite a bit of money into it. What was that process like, getting this thing turned around to the needs of Tilray?
It's the biggest, private infrastructure project that I've been involved in. I was a former city councillor, so I've seen a lot of public infrastructure projects go ahead, but this is massive scale, and it's the most cutting-edge production technology that we could bring on board. And so it's just amazing. Every day that I go in there, the project's evolved, changed, and moved forward, and it really looks great right now. We actually can't wait to bring you guys in once we're ready to bring some cameras in there.
So you mentioned 2,000 patients to start. You want to get to the end of the year by 4,000. What's the cap? What's the ceiling of this particular facility? Are there restrictions based on size? What is the limit of that facility at Duke Point from Tilray?
Well, we feel that we can meet whatever patient need, our Canadian patient need, is out there. Certainly there's a physical limit to what we can do at Duke Point, but that's part of our business model. We also know and have been approached by some other licensed producers who are eager to be associated with Tilray and sell their cannabis through us. And so if we have a need to look elsewhere, we have a lot of people who are otherwise licensed producers who are happy to help us supply the Canadian critically and chronically ill Canadians throughout the nation.
Very interesting stuff, Philippe. That's some outstanding information. We'll take another break, and we'll hear from Sasha Angus will join the conversation, CEO of the Nanaimo Economic Development Corporation. Nanaimo starving for some high-paying jobs. That's where Tilray comes into the equation. Also talk a little bit more about public safety as well. Head On continues on Shaw TV right after this.